He didn't even take a second thought for me to give a call to him. So that is how we have Dr. Madan Kumar M K with us. He is the Assistant Professor of Rachana Sháríra in Govt Ayurveda College, Thiruvanthapuram. He finished his BMS from Coimbatore Ayurveda College and PG Rachana Sháríra from Alvas Ayurveda Medical College, Moodbidri. He's a PhD scholar in Parel University. He's a practitioner also since 2006, and he's also involved in yoga therapy in Karali Yoga Center. He's a member of American Association of Anatomy since 2016 and Yoga Alliance since 2020. He has 5 international papers to his credit in California, Philadelphia, Denver, Washington, and for American Association of Anatomy, American Association of Clinical Anatomy. And he has undergone training in fascia dissection with Tom Mayer, who is also known as the father of fascia. And most important, he holds a patent to his name in the hydrodissection machine. Hydrodissection, which is of huge interest to us as Ayurveda Vaidyas, a huge interest especially because we really want to see Kala. We want to see the 7 layers of Tvak. We want to see the Sira, Dhamani, Srotas, everything as it is. We are actually wanting and yearning to see it as it is. So let's not waste our time and just move ahead to see and learn what Dr. Madan Kumar has worked on the hydrodissection. Over to you, sir.
I'm extremely glad that I got this opportunity to give a talk on this subject. It's been a long time I am not taking a class because my interest keep on changing into different things. So for a long period I was mostly interested with this dissection works. Then my interest changed to some other topic, then I was became that topic. But it's a callback for me to do this talk. So let us go to the subject directly before I go for some introduction. So the idea of the dissection was I have completed the Rachana Shareera PG and then I started working with some colleges. I started doing the dissection and there was nothing new to do here. Just do the same dissection, you explain the same subject. There is nothing new. So students also they join, they don't know, they are first years, they just come whatever we say, they just listen to that and they follow the dissection manual. So it was not that. So always that's the main thing when we come to the teaching is like the students are the motivation. Only students can be good teachers. So a group of students started asking me questions regarding this. So I thought like, okay, let's do it. And we started it with a small aquarium actually. We started with a small aquarium and we want to start with any specimen. So I had like a opportunity to start with this, with the palm. So we started in an aquarium and made the aquarium run with a running stream of water and the specimen was kept there and we used to brush with normal brush, it was like toothbrush. We used to brush it and see what's happening. So that's how it started. It started off in a very simple way and we saw that there is some way of peeling of the tissues and we can go into it in detail. So that system was gradually developed and the interest went more into it and we started working on it. That's how it started. And before you come to the word Pratyaksham and Shareera. So Shareera means like people use the word anatomy, but anatomy is not Shareera. It is anatomy is Anga Vinishche. That's the right word to coin. Anatomy is Anga Vinishche. You should not call it as Shareera. Shareera means study about the body, but anatomy means it is Anga Vinishche. So when it comes to Sushruta, Sushruta is coining the word Anga Vinishche when he's talking about the gross anatomy. So this, today's presentation we have like 2 parts. One is the dissection part. So how to do the dissection explained by Sushruta, how to do an experimental way. So today, now people talk about more researchers, they're talking about the translational research, then simulation techniques. These are the 2 things which is now highlighted, like the syllabus and everyone there. You have to have translational research, you have to have simulation techniques. So this is a attempt to do both actually, simulation and translation. Then the second part is more concerned one, that's like the Guna Shareeram. So that's what I want to convey, because that's the main part. Like when we come to the Ayurvedic part, we have to convey the message of like what is Guna Shareeram and what is the Pratyaksha Shareeram and Guna Shareeram. We have to have a very validated view on guna and pratyaksha. It is two different concepts, because when it comes to the clinical it is different, when it comes to an academic point of view or a research point of view it is different. So this it's like visibility problem, because when we use the word Sushruta we say the word hydrodissection. That's a word used, is hydrodissection. But it's not the right hydrodissection, it is hydrodissection and preservation method. It is HDPM. It is hydrodissection and hydropreservation. There is two things involved. There is a dissection is also there. There is also a preservation technique is also there. So these two things is being coined, because now we have international papers on this hydrodissection. If you type the word hydrodissection Ayurveda, we will get into the Ayurvedic papers. Before, when we use the word hydrodissection, we will go to a technique of surgery used by surgeons for hydrolineation, used by the ophthalmic surgeries. But now we have published articles, sufficient articles are there, because we use the word hydrodissection and Ayurveda. We are getting into the Sushruta's hydrodissection method. But number of times we try to change the word hydrodissection in the Wikipedia and say that it is an Ayurvedic techniques. Within 5 minutes, they will re-edit that back to it is an ophthalmology technology surgery. Okay. So that's experimental. So the experimental design was, so as you know that Sushruta was using the water current as a medium of preservation. Medium is water. So what kind of water is it? It is a running stream of water, and also we have to consider the temperature of the water, and it is always kept in a higher altitude, and this none of these procedures has to be done, expected to be done at the Himalayas, not into the areas where we talk about the southern areas. And because there are some historical evidences that this technique has been noted by some of the Chinese travelers. They have noted that there is a dissection technique in India, that they have been studying anatomy on the corpse from the running stream of water. So that is being documented. So that was an evidence that we got that it is done at the Himalayas. So definitely the temperature is a factor. So the water temperature has to be maintained. So when we are designing the machine, designing the hydrodissection technique, we make sure that the temperature of the water was like to be maintained like 3, 2, or even at the negative temperature, because if you want to make it ice freeze, you have to make it. So we standardize the temperature, so it is like so the first part was designing the machine. That means this machine has to be designed. So we designed the machine. A machine was designed with all the criteria. It is a like surgical instrument, so it was a 304 gauge stainless steel machine. It's like a refrigerator where the continuous current stream of water has to be there, the temperature. And then the flow has to, the water flow has to be maintained, and afterward there should be an outflow is also there. The outflow water will be there, that will be recycled, will come again, and will recycle. The same water is recycled, and again it comes, the continuous flow. The pressure of the flow can be maintained. If you want a high pressure, we can maintain its high pressure. If you want to reduce the pressure, we can reduce the pressure. If you want to focus on any areas where we need more pressure, we can focus on that area. So there is a cage. So a cage is also maintained where the specimen can be kept in different position. You can make it lat if you are doing the medial aspect, if you want to do the lat. Check. The aspect of, if you want to do the different aspect, we have to maintain the. If we want to maintain the different aspect, we have to maintain the cage according to the position. We can change the position of the specimen within the cage. So there was a cage. So just give an idea of like what you see. It is fully illuminated, so we can see from outside. The temperature is there, water control flow is there. The heights can be adjusted inside. If you want to make it top or down, we can maintain the height. So main question was like, whenever this dissection is taking place, what happened to the debris which is coming up from? So all the tissues which will be gathered, so tissues will be collected by a filter. The filter will be collecting all the debris, and that is like, just like you have an aquarium filter, you can use like layers of filtration. The debris will be collected, and once you can take the filter out, you can wash off the debris and you can replace it. You can wash off the debris and you can replace it. So that is, it's like. So there was a question like, what do you do with the debris? How you take the debris, you wash it, and you keep it inside the bleaching powder, keep it for 1 or 2 days, and afterwards you can dispose it. So you can disinfect that filter. The filter can be disinfected, and afterwards that filter can be cleaned and kept again. So in the initial dissection time, it will be less. Once you start doing the superficial fascia, the fat and all, the filter will get collected within like 2-3 hours. It will get collected as the flow is there. This we will show, once we see the dissection, we will show what it is. So there is a like a stand, podium is there. You can keep your textbook there. You can see the images. You can, if you want to have the tab, you can keep the tab. If you want to have the dissection textbook, you can keep the textbook there and do the dissection within the instrument. You don't need to take it. You don't need a dissection, additional dissection table. You can do the dissection within this machine itself. So that's actually a mechanical brush. It's an electric brush. So that's a dissection tray. So if you want to give additional jet pressure, we can use a gun which can give more pressure. These are some auxiliary things which we wanted, just to improvise the machine, that's all. Internal arrangement for the water pump circulate, inlet and outlet. So that is the cage which is mentioned. So inside that you can clamp the structure. This is a prototype that is for 100 liters. This is for, you can remove everything and clean the inner surface. So there you can see some cage-like thing in below. So that's a filter. That's a filter which you see there. So inside that there is a carbon ceramic. So that will be giving an effective filtration. Carbon and ceramic is there. Activated charcoal is there. That is a carbon. Activated charcoal and ceramic is there. That will do the filtration. So inside. So what's the advantages of that? So why you need all these techniques? See, one is it's a chemical-free dissection. That's the first thing. It's a chemical-free dissection method, and it's very eco-friendly dissection also. We are not having any kind of like all this formalin and the disposal of formalin into the where it goes actually. Most of the time we don't, where this formalin is being flushed out we are not supposed to say it in public, especially when we are working in government colleges. We cannot say that this formalin is again moving into the public sewage canal. But it is happening. That's the amount of formalin which we is dumping into the sewage canal is very high. And the view, that means the hydrating the tissue. So madam was talking about the view they are getting. So why we enhance this view? We are enhancing the view of the tissues. What is because we are hydrating the tissues and the water is getting more hydrated. The other dissection is dehydration, because you are using formalin means you are drying up the tissues. This is reverse. You are hydrating the tissues. Hydrated tissues will give more live view will be there. So hydrated tissue view is there. So we have a different view. Then the planar view. The thing is cut open is different method and a planar view. Suppose you are seeing the MRIs or CTs or anything, because we see it in slices. But dissection is always you see it cutting and opening it. So we never see many structures which is in its original form. We always see it in a cut open form. But here a planar view is there. So that planar view is the radiological view which we have. So then the facial planes and myofascial identification and the description of the nerves and arteries, veins and all. Because we say most of the time when we have open discussion with a lot of people, they say, see, Ayurveda is not talking about the nerves, they are not talking about, your number is always different. You are talking about 700, you are talking all different numbers. Your numbers are not matching the allopathic numbers. Why? Because both are viewed in a different way. When you count something 1, 2, 3, you count something 1, 2, 3. You are counting in a different way. From medial to lateral when you are counting, and when you are counting from upper to the superior to the inferior, you will get an entirely different count. That is 100% sure. Only because Sushruta's viewpoint of dissection is a planar view, and all the counting is done in a planar view, not in a horizontal view. So that is, the planes are more important. So that was part of then we went to the dissection. So I would congratulate, like there was a small model of dissection, hydrodissection kept there. Whoever made it, I was very happy. See, all the herbs which is mentioned, it is being mentioned. So all the herbs are there. So all the herbs is being exhibited. Vikusha, the Valkala. So Valkala, if you want to use the Valkala, you cannot use it as like the blocks. You have to make it, you have to pat it and make it like a sheet. Then only you can wrap it. So you have to make it flat. You have to make it soften the tissue, soften all the wooden bark and everything. You have to soften it. You will see the video and you will get an idea, because you already know the topic. So I just show you the video. all the scalpels were converted into brushes. So we need to change that because that's the technique we are using. So the scalpels has to be converted to brushes. So we don't have a detailed view of the brushes, so I just showed it right now. Periodically the specimen will be taken out and you have to brush it and keep it again, wrap it and keep it again. So it's an in-between step which is showed like we have to, because the skin, depending upon the type of the specimen you have, sometimes you get a very soft specimen, sometimes you get a very dry specimen. So depends on that, you have to do the brushing so that the hydration takes place adequately. So this one was a very dry specimen. It was hand. It was hand. So it was a why hand is separate? Because that's the most dehydrated structure. It's very difficult to see the muscles of the palmar muscles. Is very difficult to identify in the textbook in your normal dissection. So we so in our college, like the right arm of most of the cadaver is missing because it's all for hydrodissection. So it's so that's so we have to in between you have to brush it, wrap it again, and keep it. Music is for motivation. It's not actually for, no, we don't put music and do the dissection, but music is for our motivation. So, so you have seen, like, so one thing is the view is more important. So we need a 2x zoom. So whatever structures we have, when you are doing this hydro, even there is a magnification, we keep a 2x zoom glasses, googles for getting the structures more clear. So while we are doing the brush dissection, it's not easy. Your eyes can miss a lot of things. You will miss a lot of nerves, you will miss a lot of septums and everything. But you have to use some 2x zoom to do the dissection. So hydro dissection always has to, because we cannot completely rely on our eyes, because Indriya, yogas and everything is there. So my vision is not the same as like 5 years before. It has changed. So for hydro dissection, when you are doing dissection, you have to use say 2x Googles you have to use, and you have to use the brushes. So brushing dissection may be difficult. So that is why we have selected a rotor machine is there. So you can use that. That is a wood carving machine. It's a wood carving tool. So you can use a wood carving tool and do the technique. So we will see some more. Removal of the epidermis. It's a wood carving. That noise is of the fan, it's not the machine. Okay. Machine is very silent. So you have to do the brushing adequately, and so once you have identified the structure, you have to do the brushing and again wrap it, or if you don't want to wrap it, without wrapping also you can keep it inside the machine. You don't need to wrap. The wrapping was just for our, just to tell that Mr. Sushruta's method can be done like that. Without wrapping also we keep it in the machine and you can soften the tissues. This demonstration is how soft it becomes. It becomes almost very light. The softening of that structures, like because of these structures, it's more very viable. You can use all the kinesthetic movements. You can do all the kinesthetics and identify the structures. You can feel the tendons. You can feel all the structures. It will be very smooth. Shows that you can continue the dissection, because once you get this softness, you can start doing the dissection will be more easy. So that's like normally we do it like layer by layer, we do the dissection. So after that, it's like, so then we need a dissection manual, like what we see, how we see the structure. So then afterwards we have to make a dissection manual and see how, and because for future references we need an atlas. So we make a dissection manual. So this like the first exposure is there. So once you get this, so the structure which you saw was actually an embalmed. Unless I don't tell that it's an embalmed specimen, nobody will know that it's an embalmed specimen. So that's the liveness of the structures what we had. Because many of the times people think it's a live specimen, but it's not a live specimen, it's an embalmed specimen. We rehydrate that and finally we take it further, because it was very difficult. Ethically it is not possible in India to get an unembalmed specimen to do this. So now, like recently in Parul University, they have come across some research project regarding that, but it was not easy. So always we have to rely on the embalmed specimen. We have to we have to keep it and rehydrate the tissues, and after that we are. So it takes like 10-21 days to rehydrate. So how I rehydrate is, I keep it inside a basin and keep it in a running stream of water for like 7 days or 14 days. After that only I take it and wrap it, or without, we keep it for the hydrodissection. So we have to dilute the formalin. We have to completely dilute the formalin before we do this. We have to wash it thoroughly. So you will see one scraping. Like sometimes it's not like brushes. We are also using sandpaper, so are also used for scrubbing the cuticle, because in some cases the cuticle will be very thick or the epidermal thickening is very high. In that cases, you will be using sandpaper. Or some brushes are also available, but sandpaper also used for this brushing. We come into the different layers actually. I don't know how much it is visible from there. So this is a dry view of the superficial fascia. That's the fat part, the superficial fascia. But once it gets hydrated, you get into a very slimy view. You can see the change of the superficial fascia. Usually when you do the dissection, you will get, it's a blade with, usually in the dissection you will get this kind of view, which is very common. But once you do the dissection, you will get, in the water, you will get this kind of, because we can see how the fascia is, the superficial fascia, how the superficial fascia, or how smooth is the superficial fascia is. And afterwards, so this, we get into superficial fascia. Once you get into the superficial fascia itself, so this was like a game changer view for me, because once I got like this, like once I did this and I got this, and my dissection got stuck here, because I want to confirm what this is. Because superficial fascia means after superficial fascia you will find the deep fascia. So I was asking so many professors and from anatomy department of medical colleges, and I asked them what is this fascia. So they told it is superficial fascia. So they don't have an answer. In the textbook also it is only superficial fascia. But after 3 years, I got the result that the superficial fascia is having 3 layers. The superficial fascia itself is having 3 layers because it is only radiologically identified. It is not dissection wise identified. So we get that 3 layers in the first dissection itself. We get all the 3 layers of superficial fascia also, because if ever we see the palm, the structures are embedded. Means even though we say the veins are superficial, the nerves are superficial, the veins are superficial. Below the veins you have on top of the veins you have a fascia. Below the veins you have the fascia. Above the, so everything is wrapped and wrapped. It's called wrapped. It is wrapped, one fascia wraps and another layer of layers of fascia. That is why if ever you see an inflammation happening in your palm, you can see your palm becomes like a ball. But your elbow or in the other area, your forearm is not. Your forearm doesn't becomes like a ball. It's like it can increase in size because there are a lot of spaces here. So all these spaces can be filled by inflammatory tissues. So inflammation can happen. So that's why if you get a small inflammation or anything in your palm, all these fascia, these superficial fascias are areas where are spaces where inflammation can spread. So that is why, and the nerves get compressed very fast. And that's why you get very peripheral pain of the neurons are very high because of this facial arrangement. Because this facial arrangement in your palm, this statement is told in grace. That means the intrinsic structures, all the intrinsic structures in your body are so much found in the palmar anatomy. So it's very, you will find a lot of structures. And the facial complication is very heavy. You don't know where this fascia ends. It comes and abruptly ends at some bones. But these fascias are all layers. Making a lot of layers. So these layers are easily separable. These layers are easily separable with this. We directly go into these layers. Only thing is we don't have a literature references for such things. You go for the fascias and okay, then that fascia is removed. Again, you will find the superficial fascia is not over. It's still continuing. I told that there are 3 layers. So the superficial first layer is over, second layer, third layer. Then only we comes to the deep fascia. Afterwards, you come to the deep fascia layer. So you can remove it. So afterwards, we use a pressure. The pressure's intensity will change. So why there should be a brush dissection and why there should be a blade dissection? See, it is all about your cognition. You are using a blunt dissection, you will understand the consistency of that tissue more. If you are using a blade, because the blade is very sharp, you will never understand the consistency of the tissue. So when you are doing it brush, even more clearly, you will understand what exactly, how the deep fascia is different from superficial fascia. You will understand when you are using a brush. You can see that your cognition is different when you are using. That's why we have that scalpel with the tip is brush. So we can know the intensity of the tissues, like okay, how much pressure you need here. So there is a cognition level, you will understand what's the difference between Medadara Kala and Mamsadara Kala. There is texture differences there. So which one is more Ruksha, which one is more Kadina, which one is more Smikta. You will get that during the dissection. You will feel that, with how that consistency changes. With the blade, there is no consistency. You just cut and off. So there is, we don't have a cognition of the tissues. So Sushruta, why brushes are important? This makes a huge difference because your cognition to the tissues and which different tissues you will use different brushes. Somewhere you need to use a animal brush or like a horsehair brushes are there if you want to do. So in some areas you have to use very hard brushes like bamboo brushes are used. I have used different brushes there. So these brushes are very important to see which tissues are, what is the consistency of that tissues, how your nerve is different from. For nerves, when you are doing the brushes, it is easy. Nothing will happen to the nerves. But for the vessels, the brushes will damage the vessels. So there you have to use a horsehair brush or something to lift your vessels. So brushes are different for different structures. Then you can separate. So needles were used for separating of the fascias. So almost we do the structures like, it's a deep fascia. So it's a deep fascia. When we go into the fascias in your digits, the digital fascias are identified. Then we come across all the structures. So I'm going into much detail. So afterwards we make an atlas regarding that, like how this formal atlas has to be prepared, like how the structures has to be identified. So this is the type of brushes which we are used. It's actually a playable video. Just a demonstration of the brushes. So different brushes are used. Mostly it is bamboo brushes. Then we get brushes from coconut husk. Brushes are there. So different brushes were used. So these are like the type of bristles we are using. Some metal brushes were also used. Fine brushes were used. Bamboo brushes of different intensities. Very hard brushes and very soft brushes are there. Metal brushes. So these are like machine assist. So you can use the machines. The machine assist is there. So if you want to go in between the web and all, you can use the machine assist. Machine assist is more faster. This is the machine assist. So this is like a wood carving tool. So this wood carving tool, it can be connected and you can use that carving end. You can change the type of brushes you want and you can use that for the different types of issues. So that was the methodology we used, like, to do the dissection. So what's the outcome of that? It's like you find all the structures, what it is used. I personally find there is no use. I just found it, that's all. Because for treatment, you don't need all these structures. You need to identify the quality of that and identify. Because if it is snayu, you need to know what is the snayu, what is the quality of the snayu, and because we need to know the structures, we need to identify the texture. So we need the guna-based understanding of the structure is more important for getting into this process. Otherwise, we can say competently we have, say, a more advanced dissection technique than Cunningham's. That's what I should say. It's a more advanced technique, a more advanced dissection technique. But what we gain out of that is we get a structural identity. Structural identification is possible. We know the technique, but what we assess from that is the guna shariram is what we have to get from the dissection. So how you get into the guna shariram? So what is the guna-based analysis? What you do when you do a shariram? It's a guna-based analysis. So simple example, like you are doing the dissection and you see the main thing which you come across dissection is fat. The simple thing is, what is situated? Where is this fat situated? You see that, okay, fat is situated just below the skin. Why fat has to be situated below the skin? There you should have a guna-based analysis because skin is very ruksha and it is exposing to a lot of ruksha guna. Below that there should be something to compensate that. There should be snigdha guna. So skin should be always accompanied by fat. Because wherever skin, the skin is ruksha, so just below. So that is why always, why there is enough space in the body, why fat has to go and sit below the skin. There is a lot of areas where the fat can go, but it has to stay below the skin. Why it is? Because skin is ruksha, so to compensate that ruksha, it has to have a compensatory guna policies there within the body. So that you will see throughout the dissection, the fat distribution you see in your body. So some areas you don't have the fat. If you see the visceral organs, where you have the more fat or where the fat is, where the movements is to be protected, where the movements has to be protected, fat is there. Where temperature has to be protected, fat is there. So if you see an organ, heart, if you see that heart is covered by fat because it is a organ which is fully movement. There is a movement. So wherever movement is there, Vayurti is there. So definitely it has to be having a barrier. It should be protected by a medas. So the distribution of fat is a big thing. The the Medodara, the spread of Medodara, and it is spreading from it's like we talk about the Vapavahanam. So Vapavahanam was already discussed in our classics, even though before the modern anatomist has considered that as an organ. So we are already talking about Vapavahanam. Because Vapavahanam and the fat distribution in your body is Sneha Saramayam Purishaha, because body is a fat, body has a lot of fat, because fat is the most intermediate tissue which is to be maintained by the body, maintained by the tissues. So it is a Resarekta Mamsa Medas Asti Majja, because after the Medas there is no new thing is there other than Shukra. Actively no new thing is there. It is Medas which is transformed into Asti, Medas which is transformed into the Majja. Sarekta Medas which is second. So it is Medas is a very important component. So that is why it has to be produced and it has to be stored in all the main areas. So fat distribution of your body. So Medodara Kala is very important in our anatomy, and we see that throughout the body during this section also. But fat for us is something to scrape it and throw it away. But it is the fat distribution in our body is very important. So that is one dissection. So again, you see the Asti. Where did Asti? Oh, you see the dissection and you see the Asti. You have all the because Vadasthana is there, Pittasthana, Kapasthana. You see the Asti in the Vadasthana. Asti in the Vadasthana is very Guru Guna, and Asti in the Kapasthana is very Lagu Guna. You see all the pneumatic bones and the light bones in the Vadasthana, in the Kapasthana, and you have all the heavy bones. It is again compensatory way, means your lower limb is having all the femur and everything is in the Vadasthana, where you have very heavy bones. So Asti is very Guru when it comes to the Vadasthana. Asti is very Lagu when it comes to the Kapasthana. So again there is a distribution. So this is what an Ayurvedic view of seeing the anatomy. It's not like, okay, I saw femur. Why did you see femur? What is the use of seeing it? Because you see that this femur is the main Tatrasti Sthido Vayu. So Vayu has to go and sit in the Asti or inside the Asti. There should be Majja. Means why Majja? Majja because Asti, Vayu has to stay somewhere where it is to be very stable. And Asti is something which is very stable. And if Asti is unstable, that means Chala, that means fracture. So it is stable. So within the stable, what you have a Snigdha Guna. What is that Snigdha Guna? And Snigdha Ushna Guna. That Snigdha Ushna Guna is the Majja. And there we say, oh, it is the Vada. Tatra Asmi Sthido Vayu. So Vayu is comfortable to stay within the Asti. Because of its quality, because what kind of tissue you have within the Asti. So this is how it is being elaborated. Why Vadasthanam is this. So, and you see that all the major Astis are situated in the Vadasthana. That is where Vayu is more predominant also. So there is a guna-based understanding of the tissue. So Medas, how the Medas is distributed in the body, how the Asti is distributed in the body. So that is I have a detailed picture of that. Is it visible? It's like, so there is all structures in your body has a guna. Everything has some predominant gunas is there. So that predominant gunas is identified. So suppose if you are taking Akshi is having, eyes is having a predominant guna. Suppose you are taking the Karna is having, the ear is also, all the sense organs has a predominant guna is there. So if you take the liver has a particular quality is there. So that quality has to be maintained by that particular. So suppose if you see, I will take one organ, one structure, that is Tok. If you take the Tok has to maintain the Ruksha Guna. Tok has to maintain the Ruksha Guna. But to maintain the Ruksha Guna, it has to be constantly nourished by the Snigdha Guna. To maintain the Ruksha Guna, it has to be constantly maintained by the Snigdha Guna, because it is very Ruksha. So it should not become Adi-Ruksha. So it is always a compensatory way. This is always, so always Sushruta is explaining that particular gunas of each tissues, and this comes in the embryological portion. In the embryology is different, like how the organs are evolving. When the organogenesis is explained, there he is explaining about all the qualities of all, so from which dhatu it is evolving, and because of that, which kind of guna it is predominant. So that is the guna. So suppose we can have a discussion later. I just finish it. So then it comes, that's how the methodology of understanding the anatomy is. Like we use all this guna-based understanding. Like you have to question like why this structure is here. That means there is a reason why that structure has to be placed in that region. And because of this particular guna, it has to be. So the organs in the Vadasthanam, organs in the Kapasthanam, the organs in the Pittasthanam. So most of the time we say Agni. Where is Agni located? Agni is located in the Navi. Then what is Navi Pradesham? So Navi is a location. Agni is located in the Navi. So that is not, Agni is located in the Navi means that is a locate, that is a sthana, that is a surface anatomy we have. So we should know an Ayurvedic surface anatomy has to be the Navi sthanam. So there we have a surface anatomy. So surface anatomy of the Medas. So we'll come to that. So then we have a small discussion which is like coming to the brain. So why we are not discussing about the brain is not there. So it is already discussed, it is talked about. We don't need to talk much serious about the brain factors and all, because it's already seriously discussed with them when we are discussing about the Majja. It is Sarekta Medas. It is Sarekta Medas. And functioning of the brain is already discussed. Prana, Udana, Vyana, Samana, Bana, all these things are being explained. So their functions of the brain is also explained. So it is, so you need to treat the structure there. It has to be treated as a Majja. You have to treat it like a Majja. So treatment of the brain, always we opt for the Majja based treatment is there. So Majja, which is Snigdha Mrudu, which is a Snigdha Mrudu Ushna in consistency. So coming to there, we come to the discussion of like, okay, the Vayu is there. We discussed about the qualities. So how these qualities of the Vayu has to be assessed. So qualities of the Vayu, when we say that, like how it is affecting different tissues. So we say Mamsa, Sira, Snayu, Asti, all the structures are there. How all these structures are affected by Vayu. Then we get a different Lakshanas. So Vayu is, we say that it is a set of qualities. It is a set of qualities. We cannot say that this organ is Vayu. We don't have an organ which is Vayu or anything. We cannot say this because, for example, there is like, we have a topic like Vada Vahini Sira, Pitta Vahini Sira, Kaba Vahini Sira. Why Vahini is Kaba Vahini Sira, Pitta Vahini Sira, and Vahini Sira? Whether Vayu, it is not like that. You have an electricity which is coming to the fan, which is an electricity which is coming to the light. You have an electricity which is coming to your refrigerator. Will you say refrigerator electricity, fan electricity, light electricity? No, electricity is only one. Only with which area it is being predominant. Whether it is going to the Vadasthana, it is Vada Vahini Sira. Whether it is Pitta Sthana, it is Pitta Vahini Sira. It is Kabasthana, it is Kaba Vahini Sira. So that is based on the sthanas. It is not like doshas are. So it is mostly some areas where anatomy has to be used in the proper way. It is not being used. It is misinterpreted because we say Vada is carried, Pitta is carried, Kaba is carried. It is not. It is moving to the even. So okay, of course. Then there is like some observations we say, like you see wherever we see the Mamsadara Kala, immediately it is followed by a Medodara Kala. So we see, when you see the anatomical spreading Mamsadara Kala, it is associated with the Medodara because it is Mamsam is Ruksha, which it has to be. Mamsam has a Ruksha Guna is always there for the Mamsa. So where is the Snigdha Guna is always by the Medas. So it is always balancing. You will see this when there is a muscular injury. Whenever there is a muscular injury happens, what happens is immediately all the tissues will be replaced as fat. If ever a degenerative muscular disorder is happening, the muscles will be definitely replaced as fat because it is a Ruksha Guna. Ruksha Guna has to be compensated because there is no counteraction is not there. So what happens is only one Guna comes and getting accumulated because Ruksha Guna is constantly maintaining, dusha guna maintains the mamsa, but constantly it is being attacked by the snigdha guna. So what happens is, when in muscular degenerative cases, we always have it as a completely changed as a fat. Means like most of the tissues, if you see, it is completely, even if you have a neuron, so most of the time when you have the neuron disorders and everything, if ever any surgically, when neuron is cut, what happens is, after surgery you can see, if you see the radiology, the structures are joined, but it is not actually joined, it is joined by medas. The medas is making it. So all this repairing mechanism, where any structures, where any duksha guna is implemented in the body, it is always being repaired by the quality of medas. So medas is doing a lot of repairing works within the body, which is it's a first-hand repairing mechanism of our body's medas. Afterwards, it has to undergo a lot of process to get into the actual nourishment. So the medodara, which is the snigdha maintenance of the body. Yeah, these are like some papers. It's not in full. It's some papers which have done like a comparison between dissection of done using scalpel method and the dissection using hydrolysis done by the UG level students. They have done some dissection with the scalpel and not within the machine. They have used an aquarium and take the specimen out and done some studies. So how far it is useful for them, how much they could use that. So it was found very effective. So what is the classical outcome of a hydro dissection or this Ayurveda dissection? Means like you study about the tok. Our concept about the tok has to change. Means like we say 7 layers. We say, oh, everyone asks all the questions. Sir, did you dissect and you see all the 7 layers? I say I have to dissect and see the whole skin of the body to see where there is 7 layers, because everywhere there is skin has variations. The scalp skin is different, your elbow skin is different, your palm skin is different. So everywhere you will not be able to visualize all the skin. Maximum 7 layers. So that you can, so as per me, it's like it should be available if you should do the scalp. So scalp, you will get all the 7 layers. Everywhere it is not easy to get because skin has got variations. So that is skin. Then the kalas. So kala is like medodara. So mamsadara kala, medodara kala. Mamsadara kala is like a very extensive study material, which is like like one of the main area of keen interest of area of study is like mamsadara kala, because we have a new outcome when you come to the mamsadara kala. Then Mamsa peshis, the types of peshis, because the types of muscles which we are going to explain. And we can have our own explanation of the muscle, because the muscular muscles will change. Because in sometimes how to count the muscles, like we have to count in our methodology, we cannot count in the modern methodology. Because when we have 3 heads, they consider when there is a biceps. How can we count? Biceps has to be considered as 2 muscles according to Ayurveda. But for modern, it is single muscle, because there is 2 heads. So it is a different way, because the entire number will change, but you will see almost the same number you will get if you count it with all the heads are individually counting, you will find the same numbers. So counting the mamsa peshi. Then koshta. Koshta is like you identify the visceral structure. So visceral dissection, I have not yet done a lot of visceral dissection, but we are trying to do the visceral dissection, especially the pelvic area dissection. We are trying to do. Then Koshtangas. Koshtangas, every organ scan, you can take the heart and keep it in the machine and you can do hydro dissection and see how the heart will look like. Not every time you have to use. So individual organs, you can go for a Sushruda's dissection method. Everything you don't need to do the full body. You can take one organ can be also studied with the hydro dissection and you can see the difference. If you see, like, if you want to see the layers of the scrotum, you have to keep it for hydro dissection. Normally with a blade dissection, you cannot identify that. Then Siras. So Sira is one important area where our dissection made huge contribution to that. So you want to see the Vaidya Siras and Avaidya Siras, how to count. If you want to count, you have to count it in a different way. You cannot count it using our normal anatomy text, cannot count the Vaidya Siras and Avaidya Siras. We have to find from medial to lateral. So that counting is not. We count from superficial. We have only 2 classification of veins, superficial and deep. That is not our, but in our system it is different, because we have Urdhva Siras, the Siras are like, we have the Vada Vahini, Pitta Vahini, Kapha Vahini, so it is different, because superficial veins are there, which is very thin, so where it is Vada Vahini, so thin veins are there, little more thick veins are there, so it goes in a different way. Then Dhamani, Urdhva Dhamani, Adhova Dhamani. So again, Dhamani is also having, like, so suppose pulse diagnosis and everything coming. So Urdhva Dhamani, Adhova Dhamani and Tiryagada Dhamani. So for Nadi Pariksha, we need the Dhamani, because when you get that Urdhavaha. So if ever you find out in the Vadasthana, Pittasthana or Kapasthana, which areas the Dhamani is affected. So that circulatory system problems can be identified using the Nadi Pariksha. So that's all come from our Dhamani understanding. Then Asti, as I told, the types of Asti what we have and the way we are understanding the Asti is must improve, because it's actually a Medas. Asti is Medas. But if you don't understand Medas, you cannot. Because if you want to treat, you give fat. What else you have? You give calcium, bone doesn't heal. You have to give calcium with the fat. Then only the bones will heal, because fat is the most important tissue which is considered Asti, Majja. Then the joints, types of joints we have, and then next comes to the marma. So when we do the dissection, there is nothing to, because without the prana there is no marma. So dissection and marma is, it's a foolish study. I didn't think it is, because many theses has been done like dissection on marma and prana, marma and dissecting and see the structures. Because it is a live anatomical study, it is a live area. Marma means where there is prana, then only it becomes a, but only thing we can identify some structures are integrated there. So what? So, but it is very important when you come across a diagnosis, writing a DD or something, because we need the structures for writing a DD. Suppose you have somebody is coming with a knee joint pain. So we see the OPDs, house surgeons will be there. So they write a DD, osteoarthritis, Sandhigatavada, finished. But do you think it's only the one structure? There is snayus are there, kandaras are there, siras are there. So you have a lot of DD to write there. You have Snayugatavadam to be written there. Astigatavadam can be written there. Sandhigatavadam. So how many Gatavadams you can write in one area? The DDs are very important. If you know the structure, you write the DD. If you don't know the structure, you write. Because is it like you get an inflammation of your joint, you get only problem for the joint? The surrounding structures are also affected. That means that should be your DD. That will, because the patient comes to you after 1 month. That means he's not just coming with Sandhigatavadam, all the other structures are also involved. So our DDs will improve when we are more identifying the structures, when we are getting into the Ayurveda anatomy. Our DD part, our diagnostic part will get much improved. So regional specification, again for dissection also we can follow the same pattern, upper limb dissection, lower limb dissection, thorax, abdomen, because acharyas are also following the same pattern, how to explain the marmas and all, because how the pattern of distribution of veins, sira, dhamani, everything is based on muscles, everything is explained on the, based on the regional, that means upper limb, adho shaga, urdhva shaga. So it is, so this regional specification we can have the same regional specification, dissection of the upper limb, dissection of the lower limb, thorax, abdomen, upper and lower, back. You have to do urdhva and atha. You have to do both areas separately, head and neck separately. So some of our primary concern is like tok and kala. We have to identify the modification and variation. So it's not just discussing only what is the tok. We have to see what is the modification and variation of the structures according to the regions. And based on doshasthana. So what will be the variation of the tok in the tavasthana? What is the variation of tok in the pittasthana? What is the variation of the tok in the vadasthana? There is variation. It is not the same skin. You have a skin problem, you give vamana for urdhva and virejana for adho. Why? Because the texture is different. It is the same skin, but why you are doing two treatments? It has to be taken to, because the skin of the vadasthana is different, the skin of the pittasthana is different, skin of the kapasthana is different. There is marked difference in the areas of, and because the thickness of the layers is also different, the thickness of the layers is also different in the upper limb and the lower limb and the abdominal area, because you have marked difference in the face. The skin of your face is much different, the skin of your scalp is much different, skin of your abdomen is much different, skin in the inner thighs is different. So there is area-wise difference. So variation we have to observe while doing the dissection. In variation means how much thick it is, how much fat layer it is occupying. The thinner the skin, more fat. Thicker the skin, less fat. You see the medial compartment, you have the lateral compartment, you have the medial compartment. The lateral compartment, you have the iliotibial tract. So just there your skin is very thick and the fat is less. But if you see the medial compartment, the skin is very thin, you have a thick amount of fat. So skin is thin, more amount of fat. So fat distribution, the medo dara kala has a variation in the body. So Mamsadara Kala Medodara, distribution and variation. Sira and Dhamani, types and numbers. One thing we can do is like we can count. We can count, like how to count the Siras and Dhamanis according to our own descriptions. Then Sandhi, types of Sandhi. We have our own classification of Sandhi. we have the marma Sháríra, so the different, or like mamsa, sira, snayu, asti, santi. So we get all the amalgamated areas where the structures are there. There we say it is we having marmas. So that is, these are some primary concerns while we do dissection, because we have to be careful like how this is varying. Then the next one is, one we think is like, how do you understand the surface anatomy? How to go for surface anatomy in Ayurveda? So surface anatomy is based on the doshas. Like, first of all, which is what are the structures available in the Vadasthana, what are the structures available in the Vittasthana, what are the structures. So when we say, okay, this structure is available in this area, so that doshic, so that is one surface anatomical part. Next is surface anatomy based on marmasthana, means like we already have that, in which areas which marmas are located. Then Koshtangas. Koshtangas is also again something much related to surface anatomy, because we say Pittashya, Urdhvam, Pittashyam, Malashyam. So we have these ashyas and everything based on surface anatomy. So that is also, we have to understand surface anatomy in relation with the Koshtangas. Then surface anatomy based on Asti and Santi, like we have the Santis are there. What are the Santis? So based on joints and Asti also we can understand the surface anatomy. So where we use all these things is when we want to make an atlas of Ayurveda. We use all these things to make an atlas of Ayurveda. Means like I want to make an atlas of the upper limb. According to Ayurveda means we have to explain, okay, these are the this is how the structures are distributed. We have to explain the surface anatomy based on the doshas. You have to explain the surface anatomy also, because when you are explaining palm, you have to explain in Shipram. The region is Shipram. So if the region is Shipram, you have to explain how the Shipram region is. So Shipram is a surface anatomy also. It's not just a marma. It is in surface anatomy also. We need Shipram, because explanation of Shipram is Angushtangulam Adhyastham Shipram. It's like it is using a surface anatomically. We have to use a marma. Yeah. So this is one area which Sir was mentioning today morning. Like our dissection has to enlighten towards a myofascial, because there is a facial area which is like we miss, because we use a lot. We use it like we use our treatments. We are talking about marma. We are talking about manipulation technique. We are talking about all our Snehanagarma, Abhyanga, and like rehabilitation and everything. We do a lot, but we actually miss one area is we don't study about the mamsa. We don't study about the mamsa darakala. We don't about the mamsa fascial. But that is what we have from the myofascial plane. This myofascial planes is, see how the fat distribution is in, how the fascia is distributed in your body, because you have the fascia. Fascia is the covering of the muscles, and it is extending from one area to the other area. That means suppose if I am moving the finger, it's not just my finger is not involved. It is something from my neck is also involved. It is something which connects. So all our body parts are interconnected. Suppose I am twisting to one area. So what is that twist doing? So that is known as kinetics. So kinetics is very important to determine what kind of movement. So this facial planes is identified based on the kind. So when you do the hydro dissection, you go into the fascia very clearly. We are identifying the fascia, because that's what like was explained, like why I went to this USA to study all these things, because first time I heard that they are giving fresh cadaver. You go there, they will teach you how to do the dissection layer by layer. So they are doing dissection layer by layer. They are using, it's done in Colorado. It's a very cold climate there. It's like -1, -2. At that time they have the dissection, the cadaver will be, fresh cadaver will be there. So they do skin level. They just remove only the skin. After the skin they identify the fat and then identify the fascia. So they explore the fascia from the forehead through the back and end up to the heels. So they do a full dissection of the entire and find that you have a facial plane starting from first. So facial plane, so you have different facial planes. So they identify the facial planes doing dissections. And when I was there, I was explaining him that, okay, so there is another method, because every time they do the dissection, they do the dissection only for 1 hour. After that, again, they keep it in the freezer, because the body becomes very dry. So once I was there, I told we can wet it and do it again. So we use, but it is cool. You cannot touch the water and doing it at that. So we told him that there is a technique which is told in Ayurveda, that there is a dissection technique which is using hydro dissection. So he was so much appreciating that, and these people were so surprised, like they can do the facial plane delineation by doing hydro dissection. And I came back and they did it. They did it because they did it and they were explaining all videos and everything regarding the facial planes, because every fascia as they take it, they will demonstrate it underwater. They will take a fascia and they will demonstrate it underwater. See, it is how our techniques is being valued outside. But it's a small tip from our place, but they use it for doing a lot of researches in myofascial plane. So they are using it. So this is how you take all the fascias out. This fascia. So one area where Ayurveda can contribute with hydrodissection, and that will be contributing to that, is fascia. Facial planes, myofascial meridians, myofascial planes. So that's one area where dissection, and that is also helping our marma. It is very much helpful for our understanding of the muscles, because we talk about 7 positions in massage. Why these 7 positions is, when I went to US only I understand, because they were doing all this dissection also done in 7 positions. They want to study, that's the one surprising thing, they want to study about the facial plane in the back. So what they do is, okay, now keep the position in, so they are using yoga postures for cadaver and doing the dissection. They were keeping the body in Baddha Konasana and doing the medial compartment of the thigh. I told, we know yoga, we know dissection, but we never know how to do it together. They were doing it together on a fresh body. It is like all the dissection was most of the postures they were using. They are keeping the body in the Padmasana, they are keeping it erect and doing the vertebra. We do it vertebra a number of times, we never did it in the erect posture. Means that is how they demonstrate, because they want to explain the facial plane in your abdomen. They have to explain about how the face. So it is not mandatory that you should always follow the Cunningham manual. You can follow the yoga manual also for doing the dissections. So they are doing it. So it is possible. So this is the way they are. This is how, like, how our technique has to be innovated. Means it is because we are having sufficient resource. Yeah, and there is some other areas also where our yoga, with some things which morning sir was talking about, like I was so impressed with, like the sounds and everything which is very from the Navisthana. It's very important. It's like the sthanas which is dosha sthanas is again which is come to tantra, because that dosha sthana and tantra is very much related. It is a key. It is one of the where Ayurveda about these doshas, where they are going to explain about these doshas. It's, if you want to know more, you should know the Tantra Shareeram, where how this Vadasthana, Pittasthana, Kapasthana is coming, how the sounds is being produced. So all this is related with the science and yoga Shareeram, Tantra Shareeram and Vastu Shareeram. Again, you should know something regarding. So there is some innate area. So that's why I told you I got deviated in between. I was moving on to all these areas. So my hydrodissection is pending. I am mostly into these areas for, so where we have some, what I have to summarize is like it is something related with kinesthetics. So our hydrodissection will give a lot of insight into kinesthetic. Kinesthetic is like study about movement, because live body. Kinesthetics, that is what we are talking about. All sir was talking about marma and everything. It is all kinesthetics, how your movement is affected. And because how your movement is affected, how you restore the movement. Where to touch, how to restore it. It is kinesthetic. So our dissection gives a lot of idea on kinesthetics. Next one is, it is a chemical-free dissection. So that's something which we are putting forward, because as an anatomist, I stay with the cadaver for like last 12, 16 years. It's not easy to be with the formal, involving formal. Now we have 2 batch students. So how much time we are spending in front of the formal, and that too without any security. So because formal is used so drastically. So we need a chemical-free dissection. And then I say it is more correlatable to the live anatomy. That's the another important point, because the freshness of the body, the snigdha guna or the mrudutvam of the body is very important. The mrudu guna is very important to identify the structures. So that mrudutvam is what we need to study. It is a mrudutvam. So that it is more correlatable to the live anatomy. Next one is, it is a better approach to guna shakti, because I told, like, if you want to see the guna, you should, because if you see a cadaver, what guna you see? It is murdam, and it is completely dry. Only ruksha guna you see in a cadaver. But if you see, when you do in a hydrated cadaver, or when you do in a fresh cadaver, you will see a lot of gunas. You can at least see how the fascia, how the texture of the muscle fascia. You will be able to differentiate superficial fascia and deep fascia very clearly. It is not your. So usually we never get all these things in a dissection, because the siras and dhamanis are not clear because of the dryness. So this is some advantages which we see with the Ayurveda dissection. So it's still in progress. I am not an expert to tell all these things. I'm just moving on to it. So madam called me, I just came, and a wonderful audience. Thank you. can just share, some, or any lacunas or any suggestions, I can really take into account.
Sir, very much thanks to you for giving the innovative ideas after studying this basically Ayurvedic. The thing is, I could not understand what you had told was specifically to surface anatomy of the doshas, because when we talk in terms of any of the either physiological or pathological conditions, we always go in we need not name the disease, as far as we can treat on the basis of dosha pathology only. But how we have to interpret? And another thing is, if these kind of ideas, is it not, it may be out of the way, this present sentence what I am using, in the regular curriculum, the application of these things, as far as the development is concerned, or the subject is concerned, with the help of the publications, what we do, is it not possible to recommend the development that are happening in our, on the basis of that one, so that functional anatomy, so we can correlate with that of the Vikriti Vijnana, or even in the diagnostic level, or in the application of therapeutics. I mean, my question is very multi-components, but I want to hear from you. It is very, very interesting actually.
Yeah, regarding the syllabus, that's something which is staying. So, I'm not, one part of Ayurveda which I always say, because I have been always inspired by a lot of clinicians, not by academicians, because they people tell what you have to do. I was never inspired by any academicians. I was always behind clinicians. So they tell why you study is to improve your treatment. It's not to improve your academic knowledge or anything. It's to improve my treatment. Because if you see a psoriasis patient, okay, you have psoriasis patient coming to you, you have a scalp psoriasis, you have body scalp. So scalp psoriasis has a bad diagnosis. Whereas body psoriasis, even though it looks worse, you will get a result. But scalp psoriasis, you will result, but it will reoccur. Because it is a kavasthana, it is very difficult. It is surface anatomy of the skin, because it is a kavasthanam, skin is respond different to the treatment. Vadasthanam, skin difference to the treatment. It is actually our doshas which give you the answer. And doshas is giving the answers, and we say that is where our surface anatomy is, like organs which is in the kapasthanam when he is having kabadushti, and organs which is in the vadasthanam which is having kabadushti. It is different, because we say why there is there is a simple question, sir. It's like people say, okay, you have your kabasthanam is medas is kaba, so you should have more medas in your head region. Why there is no, people don't get obese in the neck and head? Why obesity happening in the lower? Because it is vadasthanam, that is where fat is very comfortable to stay at. It's like, it's a ruksha guna, that is where fat will be easily it can go and stay in that area. So that is why it is very difficult to reduce the fat in the thighs than reducing the fat in the face. It is surface anatomy of distribution of the fat, because vadasthanam fat is easy, is very difficult to cellulates, it's very difficult to manage, but you can manage the facial fat and everything. You start fasting, your fat in the face will reduce very fast, but the fat in the thighs will not go. It's actually our doshic surface anatomy. It is that doshic surface anatomy which makes many of the time our prognosis, our treatment much predictable. And regarding the syllabus things and all, it is we are helpless, because syllabus is prepared by academicians. Clinicians are not preparing syllabus, so we can't help it. Because last time we had a syllabus discussion, and it is anatomy, Rachana Satram PG syllabus. I don't know anybody is here. They called one day and told, they forgot to put the Ayurveda topic in it. They prepared the syllabus. It is prepared. It is kept for discussion next day. They told they forgot to add the Ayurveda topic. They put only the modern topic. So suddenly, sir, can you write some Ayurveda topic and give you? We have to syllabus discussion tomorrow. This is our. Desirable. It's all desirable to study. But this is the situation. Like, the more you pumping. Because the amount of money, I think, like amount of money we spend on modern textbook and the amount of money we spend on Ayurvedic textbook, it is much difference as improving a lot. It's getting academic. I think academicians has to take all these things into consideration. Otherwise, if they don't take the clinicians into account and discuss come to the syllabus, it is going to make a huge destruction in the education field. It is going to help. Any other questions?
Yes.
Namaste, sir. Thank you very much. Just a very simple question. You said you can either keep the organ, the avayava, in the water with wrapping or without wrapping.
Yes.
So, does this make a difference? Did you practically feel that there was any difference there?
So, most of the time we get an embalmed specimens. That is why I do it. You can take, if you get a fresh specimen. Suppose you are getting a specimen like suppose I get a specimen from I get a buffalo kidney, beef kidney. If I am getting a beef kidney, I will go for wrapping it and then doing the study. But if I get a specimen which is in my cadaver, which is already preserved with a formalin, I just keep it in the water and hydrate it and then go for the dissection. But if it is a fresh specimens, it is better to wrap, because wrapping gives two things. One is the wrapping is the texture of the tissues is maintained. One thing which I have noticed is you never get any offensive smell. You never get any offensive smell, even though you are not running, the running stream is not there. The text and the color of the tissues is also much more stable. The colors of the tissues are also, maybe the what do you call, the ashwatha, all these like nalpamara, all these things is giving some text, giving some color combination. Colors has got some influence. The color fixing is there. The texture fixing of the tissues are also there. But if it is a fresh specimen, we always go for a wrapping. If it is an already preserved specimen, you are just diluting with the water. You don't need the wrapping.
Namaste, sir. It was a very insightful session. So my doubt was regarding about what you talked about compensation, sir. Like if it is the Vatasthana, then there is, more of Medas and all. So if you're thinking like this, in the line of treatment, sir, if not about dissection, if it is happening in the live person, if, as you mentioned, in the Vata, like in Vata Vyadhis, what is happening is, if there is compensation of Medas or anything, then we treat it like Avarana, no, sir. There is no repair happening. So is it like only in Mrita Sháríra you observe that, or it's happening in the body to repair, but it's not happening?
That is my question. Is there a repair happening? Is there a repair happening?
No.
There is many of the times when some structures are damaged. So suppose a person is having atherosclerosis and you have like the sclerotic changes are there and you have it is collected, the fat is getting collected there, and afterwards again what happens is you remove the fat, again afterwards it will come to the same position. Because most of the time irreversible damages are there, so it is only some compensatory mechanism which help you to survive. That's all. It's not, there is no complete cure when you say this Vata Vyadhis and all. Is there a full repairing of a Vata? Is there a full repair of the tendon possible? Is there a full repair of a nerve possible? Then, because there is a compensatory, because there Vata is disturbed, you can compensatory give some opposite qualities and it will manage, and that is why we have Sadhya, Susadhya, Kachra Sadhya, Asadhya classification is there, because many of the time these compensatory things are only working in that particular area. So you have to get satisfied with that particular result, because suppose there is a, recently I will give an example. One of my wife's friend, she was doing some head stretching. Her hamstrings got pulled off from the ischial tuberosity. She had only one something which is there. She had like a small ball kind of thing. So when she was sitting, she has a discomfort. So once they took it, once they went for the surgeon, they found that the entire muscles is now replaced as fat. There is no muscle. It's a compensatory thing where the body does. If at least one or two tendons was stable, she would have lived with that fat. But that is a compensatory thing. So many of the time this repairing is not there. Compensatory things are helping us, because that structurally we are stable. So its entire tendon is moved from that area. It is a compensatory. Why this muscle has to be replaced at it? Why it is not getting replaced as some other tissues? That is the thing, like why it is not replaced as, why it is not getting replaced muscles, medas, mamsa is replaced as only medas, why a neuron is compensatorily, it is not covered by a muscle, it is only compensated by medas. So it is a compensatory mechanism. So in this compensatory mechanism, medas has a big role. That's what I was putting forward, because wherever ruksha guna happens, medas has a tendency to go and compensate that ruksha in that particular area. That's all I mentioned. It's like,
Thank you, sir.
Thank you for this wonderful, wonderful presentation. I missed your presentation in Pala. So, thank you for this presentation. So, mine is a much more drab question. You know, the modern anatomy has been literally rewritten using MRI. You know? So, have you tried to kind of do a MRI simultaneously? I know it's a fairly costly affair. But is it something that you have in mind at some point in time when you are writing the atlas, you know, based on Ayurveda? Because MRI can do a texture analysis.
after doing this hydrodissection, I always view these MRI articles, like the articles based on MRI of that particular areas, because the MRIs always give slices. They are giving layer by layer ideas. There are hydrodissection is also, we are also trying to get the layer by layer ideas.
Right.
So definitely that is the most correlatable technique to study anatomy. Is like MRI based learning of the areas are much. So that's what.
Are you planning to do it at some point in time, or?
It's like there is time limit is there. It's like it's a time is a big factor. It's like I finished in like 15 minutes, but but this was not that easy. It comes like it's the last 5 years I am doing only one work. People are asking me, do you have any other job? People are asking me that question, don't you have any other job? You are always doing it, wherever you are going that job. Can't you do anything variety? I don't think I cannot do, because variety is not the thing. Like people ask like new things, why you are not doing? Because one thing itself is so vast. So imagine if you want to work on, how many people has to work on these areas, and how many of us are working continuously for things. If we are working 5-6 years, we get big, huge result from our areas.
Here I want to ask you, Madam, if we are applying all these things, going beyond this, suppose in a pathological cases, apart from MRI, like functional anatomy, when we are thinking of in physiological aspect, especially when it comes to cancer, the PET scan using the pen, is there, I mean, it may be very odd thinking for me and for the audience now. Is there any possibility of what he has explained, surface anatomy in terms of doshas or anything, is there any possibility of thinking like this? Because PET explains the functional anatomy, functional aspect. I want your comment here, extending your, yeah, it will be going out of the way.
Now or during the break or
If made a
if it's short you can take it now. Yeah. If it's long maybe take it.
It is very much deeper, the cancer pathology.
No, I think it's very much possible. Now you have such sophisticated technologies, and as far as anatomy is concerned, and also if we want to look at it from an Ayurvedic point of view, the best technique would be MRI, because you can do a functional anatomy, you can look at the textures, you can also quantitate the textures. And then you can look at different layers from different angles. So more than PET, MRI would be the technique of choice. Not because it's my domain expertise, but it is one of the best one. No, I think we should continue.
Yeah, please. Okay. Thank you, sir.
Some organs also which you can try is like you can, especially animal studies. We have to always use animal studies, but Ayurveda people is still behind rats. But yeah. Like they say, if rat is positive, then everything is correct. But I don't know if that research is take us where, I don't know. Mostly they are talking about more rat studies. But if you see higher animals, you can see the eyes, especially bull eye and all. If you are doing dissection, if you are studying it using, if you are using a sharp blade, you will not understand what's that consistency of like the layers. But if you are using a blunt dissection, and if you are trying to study the layers of the eyes, you will find why it is like Vataja, why it is Pittaja, and why it is Kabaja. Because it is your cognition is very important. Because that's what very important. It's our cognition to that. Because if your cognition is what doshas are. How much you are cognizable to the doshas means like either your eyes has to be cognizable or your sparsham has to be cognizable. Because your cognition is very important to understand. Because if you say the innermost layer, the retinal part you state, it is vata. You have to feel the texture of it. Why it is vata? It is very yukshavali. And compensately, you can see all the aqueous humor, vitreous humor. There also you will see the front part is shita, the back part is ushna.
So we have
Because
to make it measurable then.
yeah, that measurable is, yeah, it is that measurability has to come. First of all, we have to measure it ourselves. Then only we can give it for standardization. First, every student has to be able to identify that. Okay, this is snikta or pichilatto. How you feel that? Everyone has to feel that structure. So that feeling of that structures is very important. If you are not just you are putting a glove and you are just using a sharp blade, you are moving. That is not the way Sushruta's dissection is all about. Because we are wearing some other shoe. We are standing in some other shoe and trying to explain something which is someone has seen everything in a very different way. So I didn't talk anything which is told about Charaka because he was entirely having a different concept from all these things, not at all correlatable with what Sushruta is telling. Because you see the srotas, srota vitta lakshana, srota dushti lakshana. So there it is completely a different perspective of understanding anatomy. That's a fully functional anatomy. Fully functionally and pathology based anatomical understanding is a doshi based understanding of so I was taught, that's why I was using the word Sushruta, because whatever I have discussed is only on Sushruta's perspective. If you ask a question from Charaka, this theories, everything will break down. You cannot explain anything based on that. Yes.
Thank you so much for an amazing, wonderful, and certainly a very inspiring work that you have done. I just won't say that it's the talk, it's the work which speaks. So thank you really so much. I'm sure the young generation here will be taking not just the hope but also a conviction that someday probably some of you would be here, not with just the palm and the limitations which sir is facing, but then with a not body, natural body, entire body which is not embalmed, and come back and then present in the same forum. Of course, we're going to have Sháríra Satram every year.
See, nowadays our technology is so supportive. We have to understand, like we are the younger generation. You are in a very supported technological world, because see, you have the high definition cameras are there. You have like freezer techniques are there. If you are not doing the dissection, you can freeze it and keep it. You can do it after 1 month. It's fine. You can freeze it, but like 10 years before, it was not the situation you have to. So everything has changed. So it is very positive that Ayurveda can be much more used or much researched using this technology which we are having. Because I never had the Googles like this 2x zoom Googles. I got it like 3 or 5 years before. Before I was using the normal hand lens to watch it. Because now your mobile is sufficient to get the zoom and get the images and everything. So it is so the next generation, the coming generation has to do a lot of work in anatomy. Definitely you will get very promising result. And I definitely say, because none of these papers was never rejected by any international papers. I was constantly rejected. Yeah. None of these articles was rejected. All articles were accepted by American Association of Anatomy and Clinical Anatomy. They were warmly welcoming. So it is like, it's a big opportunity to work on such concepts. Okay. So I just added it. Okay.
Thank you so much. But actually continuing on what Dr. Madan was saying, and remembering what Dr. Amar Sundar was talking about in the morning, about the, why are we doing research, whom are we going to benefit, and what have we to lose, and who is to gain from it. All those questions to actually rewind in our mind, even with respect to Shareera, and no doubt, of course, they will be very welcoming. It's something that they will be they're waiting for it and then they'll be gaining a lot from it. Then what about us? Let us develop our own manual, our own atlas, and at least help our own students understand Ayurveda Shareera properly in a better way so that they can implement it, apply it directly for the diagnosis in the clinical setting in an Ayurvedic way with all the confidence, with all the clarity in the perception of it, and so that they can become very good clinicians for the benefit of humanity. Thank you so much, sir. I invite Dr. Nishchal Patsarthi and Dr. Dusan Bek over to the stage to facilitate Dr. Madanji on behalf of Academy. Please, Doctor. Dr. Nishchal Patsarthi has been an Academy volunteer since 2009, presently working in Sushruta Ayurveda College and practicing Ayurveda. Dr. Dusan Bek is a volunteer of Academy since a long time. He's from South Korea, who did his BMS, MD, has been an intern with Vishika at Academy for a couple of years, and now he's pursuing his PhD in Jamnagar. Thank you, Dr. Madanji.